Ladies and gentlemen, it's your favorite Dr. Usu Jr. and I'm back again. This time not with an episode of Weird Medical Facts, but actually to fact check a claim. So join me, let's watch this video together.
So please, if somebody comes in with a cut or an injury involving a face, please don't go in for that non-absorbable suture, the nylon suture. Why? Because this one is too hard for the face. So this one has that a tendency of causing that dentation. That part is going to be dented, right? Because it's too hard, it's going to form that dentation marks on that person's face. And so please think about going in for this suture here. That is the micro suture. So any suture involving the face, please think about that one. Use the micro suture for that person.
Normally, I would ignore such videos, such claims, but a recent encounter compelled me to address this misconception. So let me tell you a story that happened just recently. I was passing through the surgical unit when I heard a group of nurses laughing out loud. And so I was curious to, the gossip in me wanted to go and hear what's going on. And I stepped in and saw a woman. She had a facial laceration just above the eyebrow. And you could tell that they'd used fine nylon suture to do a running subcut. And so I was like, am I missing something? And the old and similarly experienced theater nurse who is doing the dressing retorted, Doc, can't you see what the person has done? Some doctors are doing things somewhere. I'm like, what's wrong with this? He said, he used nylon. I'm like, oh, but who says we don't use nylon for facial injuries? Anyway, so I had to set them down and school them a little bit. And when I chanced on this video, I realized that it was actually not just hair. We need to fact check some claims, like what this gentleman is throwing out there. Fine monofilament sutures like nylon and polypropylene are not just accepted for facial injuries, but they're actually recommended. Get that? And let me tell you why. These fine monofilament sutures, unlike the braided ones, the Vicro that you are recommending, cause less tissue reaction, less inflammation, less infection, good scar outcome. So if you are going to choose a suture material for a facial laceration for the purpose of a good cosmetic outcome, you're better off going for a fine monofilament suture, not your braided one, not your Vicro. This is evidence-based. Surgical references support this. Look at standard surgical texts and guidelines. American College of Emergency Physicians, Centenary Emergency Medicine, plastic surgery literatures, and plastic surgery societies. They recommend fine monofilament sutures. I don't know if you've worked in higher centers, you would see the plastic surgeons using a fine suture as much as 4050 for the eyelid laceration, facial lacerations, and the cosmetic outcome is just excellent. You would barely see a scar. Cosmetic outcome depends on, meticulous techniques, gentle tissue handling, wound apposition, wound care, and timely removal of the sutures. This prevents the needle track marks that you were talking about. But lately, no one uses the simple interrupted or vertical horizontal matrix to close up a facial wound unless there is a need to. So let me conclude by saying